Good morning, everyone, and thank you for joining today's webcast. This is Jonathan Uddlehite, the CEO of the Medical Tourism Association, and we are going to be presenting today on the opportunities in China's emerging healthcare market. We've got some really amazing panelists and speakers who joined us today, so we're really excited for them to share their views. And we're going to be doing a brief overview of the China market in healthcare, and then what we're going to do is go into a Q&A kind of open forum with our panelists, asking them some very specific questions in regards to the China market. We encourage anyone who's participating on the webcast at any time to ask a question in the Q&A box once we get to the Q&A period, and we will, if we have time, we will cue it to one of our panelists. And if you do have a question and it's for a specific panelist, please, in your message, please put who you're directing the question to. That would be very helpful too. So with that, I would like to turn it over to Bill Cook, who helps run our Asia Pacific initiatives, and also our International Patient Services Certification Program, to do the introductions of our esteemed panelists today. Bill?
Yeah, thank you, Jonathan. It's a pleasure being here this morning or afternoon or evening, wherever you are. We're very excited about this webcast. Let me introduce our three panelists we have today. We have Pete Reed. He's the CEO of Global Growth Market. Pete Reed is a market intelligence practitioner and business consultant specializing in China, Asia, and other emerging markets, who has led hundreds of assignments for many of the world's most successful healthcare technology industrial companies. He has helped Western healthcare companies define market entry strategies in Asia, work with clients to help them cooperate in China's pharma and medical equipment sectors, and advise Chinese firms on global best practices in product development and manufacturing strategy. Mr. Reed has also co-authored a very well-known white paper called Reforming the Dragon, China Healthcare Market Opportunities. So you'll be one of our panelists. Our other panelist, Iris Shi, she's a healthcare quality consultant. Iris Shi is an internationally recognized expert in the China healthcare and insurance industry. She has more than 15 years experience in both public and private hospitals in China, recently serving in the prestigious Shanghai United Family Hospital in the area of government relations, risk management, quality, safety, and service excellence. Ms. Xi is passionate about bringing a higher level of healthcare to the people of China by bridging the different healthcare models between the East and West, an important part of which is how to best utilize the current China public health insurance scheme and its relationship with commercial insurance. And we also have Rex Hancock, CEO of Qingdao United Family Hospital. Mr. Rex Hancock has over 20 years experience in the healthcare industry in Asia, mainly in Hong Kong, China, and Thailand. In 2002, he established and operated the National Patient Center in Bumrungrad Hospital in Bangkok, Thailand, a 500-bed medical tourism hospital, and manages probably the highest volume of international patients in the world. He is presently the CEO of United Family Hospital in Qingdao, China, and is currently studying for a doctorate in business administration with a dissertation in planning on measuring hospital efficiency. So with that, I think we'll start with our webcast. We again thank you all our panelists and all our audiences listening today.
Thank you, Bill. So with that, moving on, we're going to have 12 short slides before we jump into our Q&A. And I think everyone knows that, China is, going to be one of the biggest growth areas in the world for healthcare development, the investment in healthcare, the building of hospitals, and also, we estimate it to be, it's going to be one of the biggest outbound medical travel markets over the next couple of years because of multiple factors. So obviously, China's healthcare market is expanding rapidly, and that's happening because of several different factors, such as a changing population demographics, the proliferation of lifestyle disease, increased healthcare spending, and a demand for higher quality healthcare services. And, the healthcare spending similar to other countries where it's rising fast, like in the United States, China's healthcare expenditures are rising very rapidly too, where basically, it was in 2013 about 500 billion US dollars, 3.2 million RMB, and it's quadrupled since 2004 with a compound annual growth rate of 17.2%. So one of the fastest growing rates in the world of healthcare spending inflation. And McKinsey estimates that healthcare spending in China is going to reach $1 trillion by 2020, and that's up from $350 billion in 2011. So a massive increase in the amount of spending in healthcare in China just over the next few years. And some of the factors contributing to this, some are the same issues that are happening elsewhere in the world. But because of the large population in China, it's just going to impact it greater, such as aging population, increase in lifestyle diseases, but there's also a very rapidly growing upper class and middle class in China. And that's contributing to the demand and the consumption of healthcare. And McKinsey's report back in 2012 found that China's upper middle class accounted for about 14% of urban households, but by 2022 they estimate it to be about 54%. So that's a significant increase, and therefore as that upper middle class increases, the demand for healthcare and quality healthcare services is going to significantly increase. And this is as those incomes rise, more people are going to want to consume more quality healthcare or travel for it. We have an increase in lifestyle diseases, and this isn't something new to that's unique just to China, but it is something that is growing rapidly in China, such as NCDs, non-communicable diseases like cancer, heart disease, diabetes, and other chronic diseases which are growing. And if we look just at China, China accounted for 3 million newly diagnosed cancer cases and 2.2 million cancer deaths, according to the World Health Organization. And approximately 230 million Chinese suffer from cardiovascular disease. And, that's going to increase from 2010 to 2030 by 50%. And in regards to diabetes, it's showing that when they did this study, 11.6% or 114 million Chinese citizens had diabetes. So definitely, a major impact on NCDs continuing to grow. And we're seeing that all over the world. The Middle East is having significant challenges dealing with NCDs. But I think because of the sheer population size in China, the burden it's going to put on that healthcare system is just going to be, very difficult for it to manage. And people over the age of 60 currently represent about 4% of China's population, and that's projected to reach 30% or 437 million by 2050. And I know we're seeing a big investment in China in mHealth and remote health solutions to really try to look at how things are going to be managed for the elderly within their home because of the inability to service them potentially within the healthcare system. So, the healthcare system, I think because of that, we're seeing a tremendous amount of investment in new hospital build projects, healthcare cities, governments looking to invest in very big initiatives, which present opportunities for affiliations and partnerships between Chinese hospitals and Chinese investors and international hospital groups. And we're already seeing that happen as either international hospital build projects or partner in projects in China or are brought in by investment groups. And we're starting to see a large growth in Chinese citizens traveling abroad for healthcare, the emergence of very sophisticated and well-funded facilitation companies, medical tourism facilitation companies bringing Chinese outbound who, they're looking to get a lot of it comprehensive diagnostics and checkups outside of China, and even medical tourism stores popping up in luxury malls in China. The outbound market is going to continue to grow. The investment in the private hospital sector is going to grow. Health insurance reforms and opportunities for the health insurers, and we already are seeing the Chinese health insurers start to reach out to international hospitals and starting to negotiate the initial contracts with them for referrals. And so there's going to be really, I think, tremendous opportunity over the next couple of years, and we think that this is going to be one of the biggest markets in the world for both hospital investment, hospital management, and the outbound side. And one of the only stats really out there about outbound travel from China for medical travel was Shanghai Medical Tourism Products and Promotion Platform, which estimated that about 60,000 travel for care each year. And a recent report by Huron indicated about 66% of China's 1.18 million wealthy millionaires would consider medical tourism. And I don't know if that number is accurate today, if it's 1.18 million wealthy millionaires, because I know of the impact in the stock market and the financial side and the economy of China has taken a toll recently. But the one thing that we have found is that when there's trouble in a country's economy, one of the things they invest heavily in is the healthcare and the medical tourism sector. So this is really going to be a strong time over the next couple of years as China really invests heavily. We're dealing with several different destinations in China that's focusing on the inbound side. So it's not just outbound. It's not, as they invest in healthcare, they're looking to start attracting patients for very specific surgeries from different places in the world. So it's going to be very interesting to see this dynamic emerge. So with that, I'd like to turn it back over to Bill Cook to start our Q&A session.
Yeah, thank you, Jonathan. Yeah, we want to take advantage definitely of our expertise of our panelists today and asking some discussion questions in different areas. We just mentioned the outbound medical tourism market, the private hospital sector, the insurance market in China, and the quality of care in China. So maybe in the first outbound medical tourism market, I'm Rex Hancock. Maybe we can Now Hospital. I can ask this question: what effect are factors such as increasing wealth, lifestyle diseases, and an aging population having on China's outbound medical tourism market?
Yeah, that's an excellent question, Bill. It's having a huge effect, especially in the last 5 years to 10 years. Back in 2013, I was in Thailand at the time, and we were having a meeting with the Medical Tourism Association from China. And I was meeting with several hospitals there to look at the facilities that were available in Thailand for outbound medical tourism. And I got talking to the CEO of the biggest, at the time, the biggest medical tourism company here in China, a company called St. Lucia. And St. Lucia, the CEO, he said that in 2013, it was 2014 I was talking to him, so last year, and he was saying in 2013 that they had sent patients to the U.S. for healthcare treatment, and these patients had brought in over $1 billion of U.S. dollar value to the hospitals that they'd gone to in the U.S. And he said more than 95% of these patients are going to the U.S. for cancer treatment. So, going back to the presentation that we just saw, the lifestyle diseases, cancers, they're increasing huge amount. I was just reading a newspaper article when I was on the airplane 2 days ago here in China, and they were saying that they estimate now that currently there's 1 million deaths every year from smoking, and they estimate that that's going to increase to 2 million deaths per year by 2030. And they estimate more than 50% of the male population in China smoke. So that, with the huge amount of pollution, cancer is just going through the roof. And these, all these millionaires that are here, once they get cancer, they just want the best in the world. And for them, the best is the U.S. and I think we're going to probably talk about this a bit later, but definitely increasing wealth, lifestyle diseases, aging population. There's more and more Chinese now heading overseas for medical tourism and for treatment.
Thank you, Rex. Yeah, I mean, that's kind of the information we're hearing as well, and the Medical Tourism Association works with a lot of medical tourism facilitators. These are agencies that send patients, like Jonathan mentioned, outbound or something. In some cases could be inbound to China, but we're seeing that. I mean, there's just been an incredible increase in the number, especially wealthy Chinese, looking at the U.S. particularly, but also we've heard mention of Europe and a few other destinations. So thank you for the insight on that question. And next question, we're going to go, what treatments do Chinese patients seek abroad? Iris, do you want to talk about this, or someone else on our panel? What treatments do Chinese patients, what are they looking for? What are the most popular treatments?
I can, back to what the answer of Rex, I think the cancer, definitely, the lifestyle change disease will be the big trending for Chinese people go outside of the country. And the second, as like lots of newspaper reports, like Chinese women actually like to go to Korea, our next country, for the plastic surgery. And the third, I think, could be the anti-aging. Also, that's related to the economic status of China and the Chinese people. So more and more people go to like Europe for the anti-aging therapy. So that's what I can think about the treatment. Chinese people go outside. Anybody want to add anything?
Okay. Yeah, thank you.
Yeah, just to add to that briefly, Pete Reed speaking here. I think one other treatment that's very popular has been dentistry. So Chinese heading to Hong Kong or Thailand for dental treatment. And I guess Hong Kong is becoming quite expensive these days, and perhaps the quality of dentistry improving in China, so that may be something which is not going to be quite so prevalent in the future, but it certainly has been quite a big driver, I think.
Okay. Well, thank you, Pete, thank you, Iris as well. And then, well, I think we've kind of somewhat answered this. What are the preferred destinations for Chinese medical travelers, and why? I mean, I know there's for some destinations that are cosmetic surgery, possibly Korea, and for more critical care procedures, U.S., or maybe stem cell and some other things, Europe. I've heard kind of those places mentioned. I don't know if Rex, you'd like to offer your opinion on this, or someone else?
Yeah, I'd like to. When I was talking with the CEO of St. Lucia about where the patients are going, and there were several other CEOs there as well from medical tourism companies here in China, and I talked to them, about some of the top hospitals in the world being in Europe and England, and I said, why aren't Chinese patients going there? And he said, rightly or wrongly, he said the perception of the Chinese is that the best healthcare in the world is in the U.S. He said, on his books, he has the top hospitals in England, but whenever he presents these to the Chinese people that he's getting coming through his doors who want to head overseas for treatment, they all say they want to go to the U.S. for these big expense treatments like cancer, etc. As Iris said, for plastic surgery, definitely Korea is the place to go. I'm here in Qingdao, and it's very close to Korea, and we get a huge number of people just taking a plane. It's just a 1-hour flight to go over there and get some plastic surgery and then come back again. That's definitely a growing industry as well.
Okay. Thank you. Very interesting.
I have one follow-up question regarding that plastic surgery. Are you finding that, all of them are going? Is it quality? Is it pricing? Is some of it privacy? What are the different factors they're hopping on that plane to get that care in Korea?
It's reputation. And so maybe Iris can talk about this, but as far as I know, there's been some famous movie stars and people who from here in China who have gone over to Korea and had some treatment done. I think there's some television programs that have been shown here in China about the amazing plastic surgery that has been done in Korea. And I know there's one famous story. I'm not sure if it's true or not, but there's one famous story going around China where a Chinese man, he sued his wife because he married her because she was so beautiful. But when they had children, he believed the children were really, really ugly. And he didn't work out, he couldn't understand why, because his wife was so beautiful. And then he found out that she had had thousands and thousands of dollars of plastic surgery done in Korea. And he had seen pictures before she had the surgery, and he said, oh, she's so ugly. Now I can see why my children are so ugly. And this is a story which has gone around China, and everyone knows it and everyone talks about it. So this has helped as well for the surgery industry in Korea.
No, that was a great story. I remember reading that years ago. It's definitely an amusing story. So no, that's very helpful. Bill, you want to move on to our next question?
Yeah. The next question, there's a common perception that low price is a driver for most and many medical tourists. Is this the case with the majority of Chinese patients traveling to Western hospitals? I mean, we see Latin America or U.S. patients traveling to Latin America, to Asia. I mean, one of the biggest drivers is obviously price. But I wonder if this is also the case in China for outbound medical travelers. Pete, do you want to take this?
Yeah, sure. Thanks. I don't think it is. I mean, I think with the Chinese medical tourists, you have a couple of different segments in there. So one, as Rex mentioned earlier on, it's the very wealthy people who are really only interested in quality, and they're willing to pay top dollar to get over to the States, or perhaps to Singapore in some cases, to get the best possible cancer treatment or maybe cardiac surgery that they can get their hands on. The other segment would be one which is reacting more to the combination of quality and value. So they're not really going for low cost, because even when they're heading to Southeast Asia, and we've seen a big increase in the number of Chinese medical tourists heading to countries like Malaysia, Thailand, even Philippines, and even India actually are reporting many more Chinese medical tourists coming in. But with the possible exception of India, the treatment that they're taking is actually not cheaper than it would be in China itself. And obviously they've got the travel expense and the cost of the accommodation and all those kind of things on top. So it's more, with that second segment, it's more the combination of access to the care they need, decent quality and reasonable value, but not necessarily very low cost.
You know, one question I'd like to follow up with you on that is, you mentioned something very interesting, because I was talking to an executive of an Indian hospital just about a week or two ago, who basically said they weren't sure of the perception of Chinese of India as a medical tourism destination. And I know that about 6 months ago, one of the leading medical tourism facilitation companies out of China was looking at primary market U.S., secondary Europe, and they were also interested in India from the low-cost side. And I would love to get our different panelists' feedback and input on the perception of India as a destination for Chinese citizens.
Yeah, I think it's early days for India at the moment as far as medical tourism goes, especially with origin countries like China, and perhaps people out of the UK, for example, are much more familiar with India and Indian culture, and it is for them very low-cost place to go and have treatment. For Chinese, I think the Indian government and Indian hospitals are going to have to do quite a lot of work to build their image as a destination. And for sure, the quality of treatment is very high in India across the board. I mean, all the way from major surgery through to more sort of wellness and health treatments and things like that. That's not in doubt. I think it's more about the perception and how India is projecting itself on the world stage as a medical tourism destination.
So I agree with Peter's point about Chinese people, how they perceive the care of outside of the country. So why they seek the Medicare out of some country, mainly because they want to seek high-end care, high-end quality care. So we have the basic medical insurance in China. So basically, every normal disease can be covered by the Chinese healthcare. But the thing is like the quality and the level of the quality they get from Chinese healthcare is not satisfy the customer, especially the high end of the high income customer needs. So that's why they seek outside. And about Indian, I think one thing is very important. The Chinese, like we would like to looking for the ranking of the healthcare in different specialty in the world. So as long as the media give enough information to the audience, they will seek for the care, like, the Indian, the Apollo hospital or some cardiologist hospital, they have like cooperation with Chinese hospital. So that's kind of like the channel, how people get the information, how they go get there for the tourist care.
Thank you, Yudis. I think we'll move on because we've got a lot of different questions. I mean, the next question I think that's kind of clear. I think we'll move on to what challenges, barriers do Chinese patients face when seeking care abroad? I mean, obviously there's culture, there's language. I mean, what are the concerns that they have? Maybe Rex, you can answer this one.
Yeah, I think you hit the nail on the head. The main one, of course, is the language barrier. So patients seeking medical care, where do they go? And how do they get in touch with the doctor? How do they know that a doctor oversees their case? Invariably here in China, the vast majority of them will do research on the net, and they will come across these medical tourism companies. And the medical tourism company will help them to translate their medical record into English, and the medical tourism companies will have contracted with some hospital overseas. They'll send the medical record overseas and get an opinion from a doctor I've contracted with, and then they'll charge the patient for that. Then going overseas, they will help the Chinese get the visa, find someone to help them with transportation. So they also have agents in the receiving country, for example, U.S., and they'll have an agent to help the Chinese patient to find somewhere to stay long term, and also maybe even to transfer in the hospital if the hospital doesn't offer that service. So, the big one is language. But, in terms of finding a good hospital with the internet, these, of course, Chinese do the research and find out what they really want to go to.
Yeah, thank you, Rex. Yeah, I mean, you touched on all the important points. I think this follow-up question, I mean, you've already touched on it kind of, but I mean, what can international hospitals, whether they're in the U.S., Europe, or other countries, what can they do to be more patient-friendly? And like I said, I think you touched on some of those things, the language. I think an international office is very important. If somebody wants to opinion on that or offer their Amiris, I don't know if you want to mention talk about that a little. I mean, if you're a Chinese patient, we've talked to medical tourism facilitators in China. A lot of them, they're having problems in just connecting with U.S. hospitals and getting, having a point of contact, having the services they need. So and I know it's a challenge, and the Medical Tourism Association has been working very hard on this relationship with hospitals and things. But if you could offer your...
Yeah, so first, definitely the language, because we kind of like the official language is the Mandarin Mandarin. So people like go to the foreign country, the language from like how they communicate to the physician, and also the medical record of the writing, how people understand that, how much they understand. It's really depend on a bridge, like a translator or, people accompany those Chinese people go to overseas or help them do all the transaction about the medical health, like consultation process is very important. And second is the cultural point, like most of Chinese go to the hospital, we kind of used to the, like a physician tell us what to do. We consider physician as the authority to give us information, give us suggestion. But actually, in lots of like Western model, people maybe like we put patient in the center, and patient opinion is very important. So how like from Chinese patients' perception, how this Western doctor and can provide enough information, can interpret information better, also can incorporate like the patient role into the whole process of care is very important. I mean, there's some like conflict about the physician role and the patient role, how the relationship goes is different from the Western the concept. So how the combination of that concept is very important for Chinese people too, because after the care, not only the outcome is important, but also the experience during the healthcare consultation process is important.
Yeah, thank you. And yeah, and I know it means the whole chain of factors. It's not just, I've seen it many times. It's not just the hospital. It's also, there's the hotel, there's the travel part, there's the, like you said, the aftercare once they get back home. So hospitals or medical tourism agencies that are working with Chinese market or whatever market, they need to take into account all these different chain, service chain to ensure an outstanding patient experience as well as a great medical outcome. Thank you, Iris. We're going to move on to the next section here. I think Jonathan is going to lead this, opportunities for investment in the private hospital sector.
Thanks, Bill. I know that we're seeing a lot of investment in the healthcare infrastructure side. We recently have brought some large investment groups into Europe and London to meet with some of the European providers in their, in negotiations and in talks to have some of those European and healthcare providers come manage and build hospitals in China. I know there's several large investment organizations that have contracted with U.S. hospitals to build facilities in China, starting out with one and then rolling them out throughout the country. So we're seeing, significant increased activity from the investment side in China in going out and finding international healthcare providers to manage and build out their facilities. It is it's not an easy thing. It's actually something I would say that's very tricky, and has to, have a very detailed, laid out roadmap, and standards and expectations for it to be very successful. Because when an international facility goes into China to help build or manage a project, there's several ways it can go. It can be an extremely successful project. The project can just, be average, or it can be something that actually has a very negative impact on the international provider if that project does not go well. So there are some international providers, I know several in the U.S. that were approached from the China market, and while others have gone in very eagerly, like Partners Hospital out of Boston, University of Chicago Hospital, and going over there and building and managing hospitals, there have been some other providers who said no, we're not ready, or we don't have the resources in place to manage these projects, and we're concerned about how our brand will be affected if the projects do not go well. So that's a very important concern when going into any market, not just China. If you're going to build a facility, and your name's going to be on that facility, whether it's building or managing it or affiliating it, you have to realize that if there are outcomes that are not positive, people are going to look towards that facility. And I think a perfect example of that would be from India with Wockhardt and Harvard International years ago, where Harvard was a partner and they were affiliated with Wockhardt hospitals in India. And if you actually went to that hospital many years ago, what you would see is Harvard International everywhere. Their logos were on every wall, in the elevators. The doctors, their outfits, even the major logo on the outfit was Harvard International. So what ended up happening is locally, even in India, they were referring to it as Harvard's hospital. But in reality, Harvard was in no way managing that hospital. They would do I think it was monthly or every couple months telephonic consults with the facility. But the branding within the facility made it look like Harvard was actually running it, or potentially even owning, having an ownership in the facility. So, these are some of the things, and one of the things that we've seen is when international hospitals go into a country and partner with a facility, sometimes there's the best of intentions, but they don't know how to basically contract and develop the initial memorandum of understanding, and then they don't know how to develop the actual agreement and contract, and to really have some of that foresight to understand what are the terms that need to go into that contract to protect both parties. And with that forward-looking mindset, what are the goals? What are the timelines? What are the objectives? How are you measuring the success of that agreement and compliance with it? And, so that, these things can run very well. But if it's not really thought out and those right agreements aren't signed, then those hospital partnerships and affiliations, can unfortunately be a big disappointment. So I think that's very important for everyone to really understand. And with that, I'll turn it, Bill, for a little Q&A.
Yeah. Thank you, Jonathan. We're going to go maybe to Pete Reed for this question. This section mainly we're going to be directed to Pete, but all the other panelists can also discuss as well. Can you talk a little bit, Pete, about the recent healthcare reform policies and how they're impacting foreign direct investment in China healthcare, hospitals particularly?
Oh, thanks, Bill. So, yeah, as Jonathan pointed out, the whole private investment into China, and indeed India, but certainly in China, the whole environment is something of a minefield, and certainly not a simple a thing to negotiate and navigate. And actually, the Chinese government has been over the past 5 years increasingly encouraging private investment and private foreign investment, FDI, into the sector. That's just one of the strands of the healthcare reforms that are going on over the past few years. So the other ones being, or some examples being, modernization of the management of public hospitals in particular, trying to increase hospital standards and apply standards across the board, improve processes, that type of thing. Alongside that, investment in technology, so medical equipment, of course, and then more advanced things like mHealth, telehealth, and electronic health records, those kind of technologies as well coming in. And finally, outside the hospital sector, but actually very important in terms of its impact on the hospital sector, is the development of primary care within China. So I'm sure many of you are aware, it tends to be a case that the secondary and tertiary hospitals are overloaded with patients who really are seeking primary care and just go to the major hospital as first port of call. So that's another aspect that the government is trying to reform by developing a better primary care system and educating people, particularly people outside the cities, on the importance of not going directly to their major hospital as the first point in the patient flow. So we already saw FDI coming into the hospital sector back in 2011. In a limited way, but the big announcements came in 2014. So we had Li Keqiang announcing reforms where he said the market would be, the sector would be much more open to market forces, and there would be relaxation of limits on foreign investment into hospitals, in particular JVs and partnerships within the sector. And in addition to that, some wholly owned hospitals would be allowed as well. So starting in Shanghai, I think the first one was in the Shanghai Free Trade Zone last year. They've also announced 6 other locations where 100% owned private hospitals will be allowed. So that's Beijing, Tianjin, Jiangsu, Fujian, Guangdong, and Hainan, alongside Shanghai. And that's the case for general hospitals, specialized hospitals, but in particular traditional Chinese medicine facilities would only be open to investors from Hong Kong, Macau, and Taiwan. So yeah, there's certainly a lot more opening up and opportunities for foreign money to come into the sector at the moment.
Can I add something?
Yeah, Iris, please go ahead.
Yeah. So the Chinese healthcare reform actually officially started in China in 2009. So the government at the beginning had 5 priority. So basically, because we don't have the referral system, which means patient needs to go to primary care and then to specialty care. We don't have that. So that's one of the government focus at the beginning. And also, we don't have universal coverage. That's the second priority. And also, the third priority is public health reform, as Peter mentioned. So for the second stage, like for 2015, for recently, the government actually have issued very detailed, reforming task. The most important I'm taking is for the primary care healthcare. Usually, Chinese government is dominated by the public health. 99% of the bed is dominated by the public health system. But right now, government give very clear message, we have to give 20% of market share to the private care, healthcare. So I think that's one of the very strong, reforming message give to the healthcare system, how much the share we are supposed to balanced by the private care in China, in addition to the public care system.
Thank you.
Yeah,
Go
I'd
ahead.
like to make a comment too, yeah. For healthcare reform policies, to be honest, I could talk for hours about this. It's, just impacts our work here in setting up and running hospitals so much. But I think if I would just talk about one which I call a game changer, and that is, currently physicians are tied to one hospital. They can only work in one hospital. It's like an iron rice bowl. Now, from the central government level, they've put forward this reform to say that physicians can work in more than one site, that they can work in more than one hospital. But you have to keep in mind that China is a little different than other countries. What the central says doesn't actually get implemented throughout the country. It's up to each province, each city to do the implementation. And how they implement it can be different and will be different in every province and every city. And up to right now, no one has cracked this problem of how to let doctors work in more than one place. It's because their employer has a lot of control over them. The doctors would like to work in more than one place. They really would. But the employer holds their license and doesn't allow them to work easily in more than one place. Now, I know that here in Qingdao, the local government is really working on trying to break this hold that employers, public hospitals have over doctors. If doctors can work in more than one place and can do it easily, then you can get the private hospitals, paying top dollar for the best doctors to go and work in their hospital. And this is one of the biggest things which is stopping the local Chinese from going to the private hospitals, because they know the best doctors are in the public hospitals. And now if the private hospitals can attract the best doctors and get them working, then that's going to get the Chinese patients following the doctors. So that's the game changer. When that policy can be implemented, then I think we're going to see huge change in the China market.
Thank you, Rex and Iris. Yeah, actually, this is kind of leading into the next question you see up here. Private hospitals make up 50% roughly of the facilities in China, yet only receive around 10% of the patients. So, I think you've both touched on some of the reasons for that. Is there anything else you want to mention on that, or really maybe moving on to the next question? What incentives are being offered by the government to support the private hospital development?
Yeah, there's a few things here. So, I mean, obviously the regulatory relaxation, allowing more investment in is a key thing, and that's going on in different ways. So, apart from just allowing foreign ownership or greater level of foreign ownership, it's also now possible for different types of investment to come in. So as you were talking about earlier, Jonathan, private equity, for example, is one route where a hospital group can partner up and come together with a foreign private equity firm to find a partner in China and make an investment that way. Also on the financial side, the requirements for working capital up front are being reduced. There's also, it's also more feasible to lease equipment rather than having to buy equipment outright. And the final thing on the financial side is the level of pricing. So while the government is certainly controlling drug prices in private hospitals, the control over the service pricing for the private sector is much more relaxed, and private hospitals are able to price their services more based on market forces. So a second area is also on employment, and this kind of touches on what Rex was talking about. So trying to get good quality doctors into the private sector has been an issue, and as part of that effort, the government is relaxing their visa and contractual requirements for foreign doctors who want to go and work in China from US or Southeast Asia or Europe or wherever it might be. So that's one way that they're trying to increase the level of quality in the private sector. And I think generally also the just the level of visibility that the Chinese government is giving to the healthcare sector when they speak and when they go overseas is very significant. So you have, for example, in the UK, where I'm currently, we had a visit by the Vice Premier Liu Yendong in September, just last month, and she was travelling around various locations in the UK, and in particular focusing on healthcare among other agenda items, but in particular looking at the UK primary care system, the general practitioner system, visiting clinics, making it very clear that that China is open to expertise and know-how from countries like UK and US in how to set up GP clinics, train GPs to try and bridge that gap between the patients and the hospitals, and give them a primary care and a referral system which is going to relieve the burden on the major hospitals. So yeah, there's quite a few different things going on, and just because of the high level of interest and the availability of money that is sort of waiting to come into the sector, the main thrust is relaxation of regulation and restrictions on foreign investment, but there are other elements to it as well.
Thank you, Pete. Go ahead.
Also, there's another incentive from the government is to be able to let those private hospitals and to enjoy the public insurance system. So before that's impossible, like only the public hospital can have the government insurance. But right now, more and more the private hospital get the government insurance. So it means when the patient go to the private hospital, they still can enjoy percentage of the insurance from the government. And in terms of the label, I agree that like for foreign doctor to practice in China is quite easy, and they have regulation to guide that. Also for the local physicians, because most of doctors are not willing to go to the private hospital in terms of, the research and the patient-based volume. But right now the government issue like the guideline on we should treat the doctor for both private and the public hospital the same, means they can have as long as they meet the qualification, they can have the physician like a title to get move up, to get pulled up. Like you can from the attending physician to the vice chief, you have a way to do that when you go to the private hospital, but before it's impossible.
Thank you. Yeah, we're going to have to move on quickly. Maybe I'm just going to ask just in this section, just the last, maybe from I don't know if Rex wants to answer. What do you see some of the main challenges and opportunities? Maybe just a really quick, and then it's not easy to answer quick on a question like this, but for challenges and opportunities for foreign hospitals who want to partner with hospitals in China, purchase or build hospitals in China. Are there some key challenges and opportunities you wanted to mention? Or it can be anybody, Rex, Iris, Pete, whoever prefers the answer.
Yeah, there is a lot of opportunity, for foreign hospitals who want to partner or purchase or build hospitals, and all of those opportunities exist right now. And I guess the most important thing is to look at where you want to come in and look at what kind of strategy, what level you want to come in. A general hospital, a specialist hospital, look at who you want to partner with, and then look at whether you want to go into one of these new zones and have 100% ownership and just build a new hospital, or whether there are some hospitals which are up for sale and you're interested in purchasing that. All of these opportunities are exist and are there. The challenges in doing it is regulation, and again, it comes back to the relationships. In China, there are these overarching policies where they talk about the kind of support which local and that government can give and to encourage hospitals to go in and build and set up with China. But how that is done and how that is implemented is down to the local government level. And so wherever you end up going or wanting to set up, you have to have a very good relationship with the local government. Generally, I've found they will be very, very supportive, extremely supportive, because foreign investment to go into there, it doesn't matter what kind of foreign direct investment. They know that in order to FDI going in, normally what follows the FDI are foreign nationals who want to look after it and make sure that FDI brings a good return. And foreign nationals will want to go into a city where they know that they have international care if something goes wrong. So there's really a huge amount of support coming from the government because they want international level hospitals to be set up. And so hospitals that I've been involved in, something, for example, the hospital right now, we have an issue with something simple like cars being able to access the hospital. The road which leads often gets blocked, and there's a lot of traffic jams. So the local government just the other day came up, hey, we want to help you out. We're going to build you a new road around the other side of the hospital. It's only going to be for your hospital use, and so patients are going to be able to get to you easily. So this is the kind of support that you can get there, but it comes down to the relationship that you have with the local government.
Thank you, Rex. Yeah, no, thank you. We're going to move on here, but yeah, I've seen, like Jonathan mentioned about the different trade missions we facilitated in England to London. We've also had hospitals, government entities, and trade missions coming to the U.S., so we're seeing that practical fashion right now. The interest in bringing in hospitals or capacity building and training into China. We'll quickly move on to the insurance now, and maybe especially with Iris here. I know that there's new regulations with the healthcare reform and in the China insurance sector, but from what I understand, it's a very basic insurance. I believe it's like 95% coverage right now is the number I've heard. But I think there's a great opportunity for private insurers to come in the sector and help with more premium products. So maybe Iris can come in with describe a little bit what the current insurance landscape is in China right now and how you see it changing over the next 5 years with the different healthcare reforms and things that are happening in China.
So we kind of consider Chinese healthcare system as a universal coverage, as you mentioned. Right now, the coverage rate, in terms of the rate, only the rate, is like 95%, and our target is at 2020, and we'll cover 100% of the Chinese citizens. So basically, for the public health, insurance product, we have three types. We have the for the urban employee and for urban residents. and the third type is for the farmer. They're kind of all like the compulsory. So the only difference is like the funding the funding channel is different. So for employee, like the employer or the employee have to contribute. But for the farmer, it's like the government support and also the personal support. So basically, that's how they fund that. In terms of the reimbursement, of course, the employee-based insurance get higher reimbursement rate, both in the outpatient and inpatient. And but the farmer one and they call the new rural cooperative get lower reimbursement rate. So there's a big gap, like between like 100% coverage. So suppose if the patient get like very sick disease, and the only proportion of that get covered by government, but still the out of the pocket money is very high. So the average, I think the rate in China is like 34%, although the government is aim to reduce to 30% in the 2020s. So that's how the public health like insurance system goes. But from the government point, they really promote private insurance development. So we can see that from the government, they have the regulations in 2012 and 2015, and they really emphasize and enforce how to develop the private insurance. So according to data from the WHO, I think right now the 8% of the health spending is by the private insurance. So there's some report from Chinese government that say there's actually 100 like foreign insurance company that provide over 2,000 products. But mostly they focus on the hospitalization or surgery and also for the catastrophic disease. So the product for the insurance, for the foreign insurance, private insurance is kind of similar, it's limited. So for the next 5 years, I think definitely the private insurance will get big, like a large share, and in terms of the variety, they have more product available. So that's kind of my perception on the current.
Thank you. And you think with the growing, we talked about at the beginning, with the growing wealth, the middle and upper class, what do you look at the opportunity? What's your insight on the opportunity for like a premium products? Is that something that's maybe missing in the market?
Yes, definitely. As I said, the copay is still high, and also the drug system, lots of drugs not covered by the insurance, and also the government provides low caps, and the plan is not fixable. So that's all the challenge actually for public health. So another way, there's a room for the private care insurance company. So in terms of the opportunity for the private health insurance, I think there's a lot, actually, really a lot. So like there's some suggestion they can say, the private insurance can really build like good relation with the regulator because they promote that, and they can help to simplify the claim like settlement, and also they can really cooperate with Chinese like medical data insurance system, because that's very important. You have to have the data, and then you can provide different variety of healthcare products. You can help like the lifestyle, like the high economic status person, and to provide more easy access to quality care. That's very important in China too, because the public health is provide like the care is crowded, and so most of high-end people, and they're not willing to go public hospital. So because the private hospital get developed more, so accordingly the insurance, if they can support them to go to the private care physicians or the chains like United Family Hospital, that would be very profitable for the high-end customers. There's already have some example like product by United Family Hospital with some private insurance company. Yeah. So anybody want to add that to that?
Thank you. Yeah, unless anybody has anything else to add, we may move on because we're getting close to the end of, past the end of the hour. We're going to move into just the last section on healthcare quality in China and opportunities for foreign providers, and just maybe a question for Rex here. In what areas, because I think we've talked about it during the webcast today, providers, Chinese providers, government entities seeking expertise from U.S., England, other countries. What areas do Chinese providers require expertise and assistance in, do you think, Rex? And with quality management, expertise with certain medical specialties, can you maybe talk a little bit about that?
Yeah, to be honest, it's a little bit of a sensitive topic because, talking with a lot of my Chinese counterparts who are looking after public hospitals, if we say what areas do you require expertise and assistance, invariably they will say to me, how can foreigners understand my business here in China? And to be honest, they do have a point a point in some respect, because the healthcare in China is completely different from the West. They have these huge volumes, and that's one of the biggest problems that they have. They have such big volumes of care coming in, so many patients, and how do you manage that with such a small budget? And as Iris has already pointed out, when the public health and the public insurance system will only reimburse to a particular level, and so you can't meet all the needs. Earlier, Pete also mentioned, I think, one of the key areas, and that is public health. Primary care. So China really needs a good system of primary care to try and help to cope with the huge amount of volume. Primary care and also emergency medicine, that is another area. And then I guess finally you can look at quality standards, like Joint Commission, DNV, GL. I know that more and more public hospitals are looking to these systems and are implementing them. So I guess it's to give their patients some kind of impression that they do have a good quality system, but they're not short of patients. So I'm sort of a little bit mystified sometimes to why a lot of these public hospitals are looking to get something like Joint Commission accreditation. I know that Iris has a lot of experience in quality, so perhaps she can talk about her experience and why some of these public hospitals are getting Joint Commission and DNV accreditation these days.
So, actually, I'm not expecting to answer this question, but in terms of the accreditation, actually right now pursued by Chinese public hospital, I think one of the reasons is that the government, actually the DOH, the Department of Health, to get more and more like awareness about the Chinese public health system, like the problems, like we all know, like the bad quality and the access to quality and the affordability. So because the Chinese healthcare reform, and they're trying to find a better or healthcare system and from Western which they can refer to. So even there's the Joint Commission or DNV is not by some public hospital that don't use it, but still the Chinese Department of Health actually they say 70% of the standard for our nationwide, it came from the Joint Commission and the DNV. And the second reason is for public health to looking for this commission, I guess, is because we talk about the healthcare reform, and every public hospital wants to differentiate their service from the other. They realize they're quite ambitious, they realize the problems. So they really want to see what the international healthcare system is. So that's why they try to pursue the Joint Commission or DNV and to attract more patients from the high-end customer or even from the foreign countries, because they have VIP service. Most hospitals, they have VIP service. So the target is for the high-end the customers. And third way is like I'm thinking for the Chinese, like the public health system, right now, all the administrator or the managers is kind of like a doctor. If you be a good doctor, you suppose you can be a good manager, but actually that's not the case. So they realize that there's a different methodology from management point, health management point, that need profession to do that. So that's why they seek for the join the commission or in a way, the systematic way to do the hospital accreditation. Yes.
Thank you, Iris. I think we're going to come to the end of the discussion. We're going to quickly mention something about our upcoming Congress, and then we can have some Q&A for our panelists. I just want to mention the Medical Tourism Association for working, well, first of all, I want to thank the panelists for their time here and for this very interesting discussion about the different areas of the healthcare sector in China, and we hope it's been a learning value, an educational value for our audience, and I'm sure it has been. Wanted to mention, before we go into the Q&A, we are organizing next month, November, Congress in Guilin, China, Southeast China, the World Medical Tourism Congress, Asia Pacific. That's going to be the 14th to the 16th. It's going to be at the Guilin International Conference Exhibition Center. You can see more information on AsiaMedicalTourismCongress.com. Really, the whole idea with this Congress is to bring the East and West together, healthcare, hospitality sectors, government leaders, just to encourage dialogue, partnerships, affiliations, business development. So it's going to be really unique and an exciting event.
Okay, we're also organizing a multi-city VIP trade mission trip. So we spent several years in really looking at penetrating the China market and finding the right partners. China is, as I think you've seen from this webcast and our panelists, it does present tremendous opportunities, but I think China is one of the most difficult markets for people to penetrate because of language barrier, ease of access of communication with Chinese partners, whether it's the ease of access of getting to them on the phone or email, and traveling to meet these individuals. We've also encountered, in the China market, you will have, sometimes associations or consultants who tell people that they provide access to the Chinese market, where a hospital or another organization will try to partner with them and pay them fees and end up not really getting anything at all. No ROI from their investments. We have a lot of hospitals that have gone to Chinese events or conferences and walked away with no opportunities because they couldn't find the right partners at that event or navigate the Chinese healthcare system properly. So, what we've done is by organizing this Asia Pacific conference that we'll be doing over the next 5 years, and, what we're really been focused on is bringing, the top players in China from healthcare, from investment, from insurance to our event, and then taking those who apply and get approved on the trade mission to several different cities in China, where they'll meet investors, healthcare executives, hospitals, governments, healthcare cities that are being built for partnerships. So, we're filtering out, trying our best to filter out those individuals or organizations that you shouldn't waste your time with, and then, bringing everyone to meet the top leaders that are very interested in those partnerships. So we are, very excited about the, the trade mission part, and it's going to be starting November 10th and ending November 17th. And it's going to be, in the middle of that, it's going to be our Guilin Congress, which is November 14th to 16th. So we're going to be visiting multiple cities, and we're going to be doing this trade mission every year. So it's an opportunity to specifically meet and do very high-level B2B meetings to kick off some activities. Now, if you can't, I recommend everyone participate in the trade mission. I think it's a really great opportunity. But if you can't, there's also the opportunity at the conference in Guilin to engage in the B2B networking. And, the one thing that I think is important is I always tell everyone this, that, this industry, whether it's healthcare development, investment, quality of healthcare, medical tourism, it is a relationship-driven business where you build relationships by meeting people in person. You can't do it over the phone. You can't do it over email. You can't do it over LinkedIn. And if there's a one destination where I would say that is probably the most important is in China. And so if you want to penetrate the China market, you really need to go to China and create those relationships and not wait for them to come to you. And I think it's a unique opportunity for people to build a brand over the next couple years in China and create those partnerships and beat others out who will be trying to enter that market also. So it's really a great opportunity. We're going to have some really great leaders, for some of those panelists that are on this webcast today, they'll also be speaking at our event, which we're really excited about. So with that, I'll turn it over to Bill for Q&A. So if anybody has any Q&A, I don't know, I know we're a little running a little bit over, so I don't know if we'll have a lot of time. We also will be recording, we recorded this webcast and we'll be emailing it to all the participants afterwards with the slides, so you'll have that. So one question that came in says, won't Chinese, this is from Frederick, won't Chinese patients be reluctant to submit themselves to the chances of infectious tropical diseases in countries like Americans? Americans should be too. I know that, there's a lot of patients from America, from Africa, from all over the world who go to India, where that really hasn't been a concern for them. But I'm sure there are tropical diseases in other countries and outside of India that people could potentially get. But would any of the panelists like to discuss that, if that would be an issue for Chinese patients, infectious diseases, whether it's India or another country?
Sure, yeah. It's, my experience with Chinese patients, it's not an issue at all. It's not something that they worry about when they're thinking about going to overseas to a tropical country. They're more concerned about the political environment, safety. So, for example, when I was working in Thailand, and talking to Chinese patients who were thinking about coming to Thailand for treatment, they were much more worried about the political environment and the safety there. Infectious diseases, it wasn't a concern at all.
Great.
Yeah. I see another
questions.
Yeah, I see another question here. Somebody asking about, we've talked a lot about the U.S., the hospitals in the U.S., the Chinese trusting the U.S. healthcare system. Are there any other countries apart from the U.S. and the Chinese? And somebody's asking, like European countries with the Chinese, would they trust healthcare systems in Europe, Eastern Europe? Pete wants to answer that?
Yeah, I think thanks. We have seen a big increase in the number of Chinese medical tourists coming over to Southeast Asia in particular. So I think Singapore is the one that stands out as being up there quality-wise. Thailand as well, and even Malaysia. Actually, we've now got. I think China is the fourth biggest source of medical tourists going into Malaysia. So I guess the reach of Chinese medical tourists is expanding all the time, and also UK as well. We have, while I think Rex is right saying that the US is really the sort of pinnacle of quality in terms of Chinese patients' perception, the UK is getting more onto the map, and there's been a lot of back and forth between UK and Chinese governments, which is only going to increase that. We've also seen organisations starting up in the UK run by mainland Chinese who are living over here, who are setting up end-to-end solutions to help get high-end medical tourists over to the UK and that kind of thing. So, yeah, I think the the scope is certainly increasing to a greater number of countries where Chinese medical tourists are willing to go.
Thank you, Pete. I think we're going to wrap it up now. It's got, I think, 20 minutes over. We thank you very much to our panelists, Pete Reed, Iris Shi, Rex Hancock, for being with us for this time, for their discussion, their insight, expertise. I actually believe hopefully we'll have them at our Congress in Guilin in November. So we welcome everyone to the Guilin Congress, and thank you for attending this webcast.